Okay, my name is Rainer Heun. I'm a professor of psychiatry. I'm editor of Global Psychiatry, and I just wanted to make it a bit more easy to enable people to get a quick view on some papers we recently published. This is a paper by Matej Stuhec from Slovenia, and he made a quite interesting systematic review about one issue which was of major concern, is how to treat older people who have depression, and as many older people have, they are on polypharmacy. Usually studies are very often done on healthy people, and polypharmacy is not an issue. So sadly, there are very few papers. So Professor Stuhec looked at different papers, and sadly, he found very few papers, just only one, which has 1,400 patients and was published in 1997. This is not a big problem that the paper is older, because at the end of the day, we do not have many new papers coming up with new medication very recently. So he had 16,000 papers on antidepressants in Medline, 306 only with polypharmacy. Altogether, there were a crossover from 26. When he looked at them, there weren't all older patients in there. So when he looked at the ones which were older people plus polypharmacy plus antidepressant medication, then he came up with one study. That's sad. This study has even some bias. There's some reporting bias that some patients might not have been really reported, and not all of the information was reported. And then to some extent, it's not totally clear how many patients have been lost. So that's not the greatest. However, the paper is quite interesting in a way that it's 1,400 patients, and the conclusion is more or less that there is only Setraline where there is evidence that this can be treated in, can be used in patients with polypharmacy. It seems there are very little side effects, and the one problem, what it also shows, is that there needs to be much more research on studies which have a better relationship to day-to-day clinical practice. We have in the clinical practice lots of people who are on plenty of medication, even though it seems Setraline has very low interactions. It doesn't mean it has no interactions at all, and it's a shame that other medications haven't been tested in elderly who are on polypharmacy. So thanks for your attention, and I hope it makes it. If you have interest in looking at this paper, look at globalpsychiatry.co.uk, Global Psychiatry, one word, and you will find this and other interesting papers. Thanks a lot, and I will finish this document.